Hi, my name is Sinali Fonseca, and this is my bone video for the axial skeleton. So to start off, this is the frontal bone. This here is the parietal bone. This is the occipital bone, and this is the external occipital protuberance, which is where the ligaments for the nuca attach, and that keeps our head upright. And this is the temporal bone. Now for the external view, the temporomandibular joint is right in here. The mastoid process is this part right here. The styloid process is the groove right in here. The external acoustic meatus is this portion right here. And the squamous part is the forehead right here. Now for the interior view, the petrous part of the temporal bone is this part right here, and it houses the middle and internal ear cavities, and the internal acoustic meatus are these notches here, and cranial nerves 7 and 8 pass through them. Moving on to the external sphenoid, this is the sphenoid here, this is the lateral view, and right in here would be the orbital view. In here is the superior orbital fissure, and the thing that passes through right through here are arteries and nerves. Now for the internal view of the sphenoid, this is the lesser wing, and this is the greater wing, and this is the optic canal, and these little holes right here are where the optic nerves pass. And then the sella turcica, which is right in here, is the fossa where the pituitary gland sits. See the ethmoid bone, this is the ethmoid bone right here, and let's look at the internal view. This is the crista galli, and it helps secure the brain and the cranial cavity, and these holes here, this is where the cribriform plate is, and the olfactory nerves pass through there. Now for the sutures, this is the coronal suture, which is where the frontal bone and the parietal bones meet anteriorly. This line right here down the middle is the sagittal suture, and that is where the parietal bones meet superiorly. Over to the back, right here, is the lambdoid suture, and it is where the parietal and the occipital meet posteriorly. And the squamous is, well, it should be right about here. And this is where the parietal and the temporal bones meet laterally. Moving on to the facial bones, this is the maxilla, and these are the alveolar processes of the teeth. This is the nasal bone. These on either side are the zygomatic bones, and the cheekbones are the ones that form the zygomatic arch. The ethmoid, right in here, the vomer, which is this line right here, and the vertical plate of the vomer and the perpendicular plate of the ethmoid bone are the ones that form the nasal septum, and the inferior nasal concha, which is in here, and it forms part of the lateral walls of the nasal cavity. Is the mandible. This is the body of the mandible. This here is the angle. This is the ramus. This is the mandibular condyle up right here. This is the mandibular notch, right, this groove right here. And this is the coronoid process. Moving on to the vertebral column, this is the cervical, the thoracic, the lumbar, the sacral, and this little point here is the coccyx. The primary to develop are the thoracic and the sacral, and the secondary are the cervical and the lumbar. Let's talk about the cervical vertebrae. There are 7. So these 7 here. This is the atlas, and it articulates with the occipital condyles of the skull, forming the antler-occipital joint, which allows us to nod yes. So I will demonstrate on myself. Okay, and what is unique about the transverse processes of all the cervical vertebrae is that each transverse process contains a transverse foramen through which the cervical arteries pass to service the brain. Moving on to the thoracic vertebrae, so they are right here, and there are 12. The spinous processes are these points at the end. The transverse processes are actually in here. It's the part that goes up. The intervertebral foramen are these little holes in there, and the nerves pass through there, and the body is this right here, and the position of the intervertebral discs are actually the spaces in between the discs. So this here is the lumbar vertebrae, and there are 5, and this is the sacrum, and there are 5 fused vertebrae to form this one bone, and the coccyx, which is another 4 fused vertebrae to form that one bone. Over to the front of the body, this here is the sternum, this is the manubrium, this is the body, and this here is the xiphoid process, and this groove up here is the jugular notch. Onto the ribs, there are 7 true ribs or vertebral sternal ribs, so it's 1, 2, 3, 4, 5, 6, and 7, and then there are 8 vertebral chondral ribs, which are also false ribs, so 8, 9, 10, 11, and 12. 11 and 12 are floating ribs. This is the head, the neck, and the tubercle of the rib, and the first rib articulates solely with the thoracic vertebra, the head articulates with the demifacet, and the tubercle articulates with the costal facet.